Syphilis. The very mention of this word can send shivers down the spine. It's a term that has been etched into the annals of medical history, a disease that has both fascinated and terrified humanity for centuries. The very word conjures a sense of mystery and dread. It's not just a disease, it's a narrative woven into the fabric of human existence, a story of suffering, resilience, and scientific triumph. It's a tale as old as time, or at least as old as humanity itself. From the ancient civilizations of Mesopotamia and Egypt to the bustling streets of Renaissance Europe, syphilis has left its indelible mark. This infection has wreaked havoc for centuries, leaving its mark on history. It has influenced art, literature, and even the course of wars. The great minds of the past, from Shakespeare to Nietzsche, have alluded to its devastating effects. Imagine a time before antibiotics when a syphilis diagnosis was like receiving a death sentence. The treatments were as terrifying as the disease itself, involving mercury and other toxic substances. It was a shadowy specter, feared and misunderstood. People afflicted with syphilis were often ostracized, hidden away from society, their suffering shrouded in secrecy and shame. But fear not, for we live in an age of scientific enlightenment. The dark days of ignorance and superstition are behind us. Today we have the tools and knowledge to fight back. Today we have the knowledge and tools to combat this ancient foe. Antibiotics, particularly penicillin, have transformed syphilis from a death sentence into a treatable condition. This essay will be your guide through the cosmos of syphilis. We will delve into its origins, trace its path through history, and examine the scientific breakthroughs that have changed the way we understand and treat this disease. We'll explore its hidden corners, demystify its complexities, and empower you with the knowledge to protect yourself and others. Join us on this journey through time and science, as we uncover the story of syphilis, a tale of human suffering and triumph. Syphilis is a bacterial infection. It's a microscopic invader that wreaks havoc on the human body. The culprit's name? Treponema pallidum. This tiny organism is a master of disguise. Syphilis spreads through direct contact. This usually happens during sexual activity. Think of it like a tiny spaceship, hitching a ride on a comet. It cannot survive outside the human body for long. This makes understanding transmission crucial. Syphilis is a master of deception. This sexually transmitted infection has been around for centuries, yet it continues to baffle and mislead. Its symptoms can be so subtle that many people don't even realize they have it. This is why it's often referred to as the great imitator, mimicking other diseases and conditions. It often announces itself with a whimper, not a roar. The initial signs can be so mild that they go unnoticed, allowing the infection to spread silently and stealthily. The first stage is characterized by a painless sore called a chancre. This sore appears at the spot where the bacteria entered the body, and it can easily be mistaken for a harmless bump or pimple. These sores can appear anywhere the bacteria entered the body. Common locations include the genitals, anus, and mouth, but they can also show up on other parts of the body. They are usually firm, round, and painless. Because they don't cause discomfort, many people ignore them, thinking they will go away on their own. However, don't let the lack of pain fool you. These seemingly harmless sores are teeming with bacteria and are highly infectious. These sores are highly contagious. Direct contact with a chancre during vaginal, anal, or oral sex can easily spread the infection to others. They usually heal on their own, but the bacteria remain lurking within. This deceptive healing can give a false sense of security, leading individuals to believe they are cured when in fact, the infection is progressing to the next stage. This is a crucial time for treatment. If left untreated, syphilis can advance to more severe stages, causing serious health problems that can affect the heart, brain, and other organs. Early intervention can prevent the disease from progressing. With timely and appropriate treatment, syphilis can be cured, and its complications can be avoided. Regular checkups and being aware of the symptoms are key to catching this sneaky infection before it causes significant harm. If left untreated, syphilis progresses to its second stage. This is where the infection makes its presence known. The telltale signs? A rash, often on the palms of the hands or soles of the feet. Other symptoms may include fever, swollen lymph nodes, and fatigue. These symptoms can be mild and easily mistaken for other conditions. This is another reason why syphilis is so dangerous. It can mimic other diseases, leading to delayed diagnosis and treatment. Section 5, Stage 3, The Hidden Dangers of Latent Syphilis. After the second stage, syphilis enters a period of latency. This is a deceptive phase where the bacteria seem to go into hiding. They become less active, making it appear as though the infection has resolved itself. However, this is far from the truth. Symptoms may disappear, lulling you into a false sense of security, but don't be fooled. The absence of symptoms does not mean the infection is gone. In fact, the bacteria are still very much alive, lurking within your body. The bacteria are still there, silently multiplying within your body. They can spread through your bloodstream, reaching various organs and tissues. This silent invasion can cause severe damage over time. This stage can last for years, even decades. During this time, the bacteria continue their silent work, slowly but surely causing harm. The longer the infection remains untreated, the greater the risk of serious health complications. During this time, you can still transmit the infection to others. Even without symptoms, you remain contagious. This makes latent syphilis particularly dangerous, as it can spread unnoticed. Latent syphilis is a ticking time bomb. The longer it goes untreated, the more likely it is to cause severe health issues, such as damage to the heart, brain, and other vital organs. It's a silent threat that can have devastating consequences. It's crucial to get tested and treated, even if you don't have symptoms. Early detection and treatment can prevent the serious complications associated with latent syphilis. Don't wait for symptoms to appear. Take action now to protect your health and the health of others. Section 6, Stage 4, the final act of untreated syphilis. Left untreated, syphilis can have devastating consequences. In its final stage, it attacks vital organs like the heart, brain, and nervous system. This can lead to severe complications, blindness, paralysis, dementia, and even death. Imagine the human body as a complex machine. Syphilis, in its final act, throws a wrench into the gears, disrupting its delicate balance. The good news? These severe complications are rare today, thanks to effective treatment options. Section 7. Fighting back treatment options for syphilis. The good news is that syphilis is curable, especially when caught early. The treatment of choice is penicillin, a powerful antibiotic. Think of penicillin as a guided missile targeting and destroying the syphilis bacteria. It's usually given as an injection, and a single dose can be effective in the early stages. For those allergic to penicillin, alternative antibiotics are available. The key is to seek medical attention as soon as possible. Section 8. Prevention. Your best defense against syphilis. The best way to combat syphilis is to prevent it in the first place. Knowledge is power, and understanding the modes of transmission is crucial. Safe sex practices such as using condoms can significantly reduce your risk. Regular testing is also vital, especially for those who are sexually active. Remember, syphilis can be silent and deadly. Early detection is key to preventing its spread and protecting your health. Section 9. The final word. Syphilis is beatable. Syphilis is a serious infection, but it is treatable and preventable. By understanding its causes, symptoms, and treatment, we can break down the stigma surrounding this disease. Knowledge is power. Talk to your healthcare provider, get tested, and protect yourself and your partners. Together we can conquer this ancient foe and create a healthier future for all.